Welcome everyone. So in this episode I wanted to discuss about measurement of sedentary behavior and physical activity in older adults. And this episode is based on the article we wrote on the topic. And if you're interested for more depth on the topic, you can go to vpn.com and articles, and you will find there this article with the name. And basically, as the global population is aging, there is growing interest in understanding physical activity and sedentary time among older adults and its relation with the aging process. And both of those play a crucial role in maintaining health, independence, and overall quality of life. And maybe worth mentioning there that, for example, for the independence factor, studies have been showing that strength training is very important. So the muscle strength is a defining factor often for independence. And actually also often we talk about aerobic exercise. It may be that we need a certain level of strength to be able to do the aerobic exercise. As when people get older, they are losing muscle mass, and the importance of strength training becomes more. So I think it's good to remind us that as we often are talking about aerobic and it gets a lot of attention. So strength training is very important for older adults. And as always, when we are talking about sedentary behavior, it is important that we are accurately assessing this behavior, because it's difficult to assess it other than device-based measurements, because people don't really pay attention how much they are actually sitting, and there is a lot of bias in the results, or or they are not accurate. So we will be exploring the different methods available for measuring physical activity and time spent on sedentary behavior in older adults, including both subjective and objective approaches. So if we then look at the measurement methods, so objective, or more better term would be device-based measurement methods. So if we first look to accelerometers, they are devices that can well measure sedentary time and physical activity by capturing movement in 1, 2, or 3 axes. And basically nowadays you basically only have 3 axis accelerometers available, which is more accurate. And maybe a good thing to note is that when you are using a thigh-worn accelerometer, from the thigh we can detect accurately the position, so we can detect the sitting and standing difference, so we get a little bit more accurate sedentary time than from the, for example, hip or wrist worn, which are based on lack of movement to define the sedentary time. And one consideration with accelerometers, if you are using it on the skin, for example, like thigh-worn accelerometers are often worn, is that many times older adults, especially very old or a little bit frail, they might have a weaker skin. They might have some health conditions that affect the skin, and in general the skin is not as strong and not as thick. So when you are using attachment methods, you need to be careful not to damage the skin, especially when taking away the device and the adhesive that is holding it. And there are certain ways of removing the patch. When doing this, you can use a lotion, and you should be pulling it in the direction of the skin, not perpendicular to the skin. And if we think the advantages of accelerometers, it's high accuracy, it's continuous data collection, it can differentiate between activity intensity, so the advantages are high. The limitations are the difficulty attaching on the skin if we use it like that. And if we then look at the limitations, they may not accurately capture some type of activities like swimming and cycling. It can be costlier compared to other methods, especially the purchasing of the devices, not probably the management of the or the data collection phase itself. And it requires data processing and data analysis skills. And if you're interested on the topic, in the podcast we have Dr. Nicola Camp, who is talking about choosing activity tracker to a project with the elderly. So you might get some insights from that if planning to use an accelerometer in a project with elderly people. And then in the article we have a second as an inclinometer, but basically accelerometer is working as an inclinometer at the same time, so we actually get the angle against gravity. So basically when you are using accelerometer, especially on the thigh, it is working as an inclinometer at the same time. And then from device-based method, you can use heart rate monitors, and they are measuring cardiovascular activity and can indirectly estimate sedentary time and physical activity by tracking heart rate changes. And while those are not as accurate as accelerometers, they can still provide valuable insight into older adults' activity patterns. And of course, with the heart rate, they are more accurate than accelerometers in the higher intensities. And the advantage is that it is measuring the relative intensity. So it's related to the person's response. So basically, if you're less fit, your heart rate will be higher with the same absolute intensity what accelerometer would be measuring. So if you are interested in the relative intensity, heart rate monitors are better than accelerometers. And if we look advantages, it's relatively easy to use and non-invasive. Although if you were using, for example, a heart rate belt, chest belt, it is not very convenient to wear it for several days. So accelerometer actually attached on the skin might be more comfortable. And also if you're using a wrist-worn activity tracker, you need to have it quite tight on the wrist, and the skin cannot breathe there. So it's maybe often considered easier than it is, because people usually wear it only on when they are exercising. And the good thing is that it can estimate the energy expenditure. Like I said, it's measuring the relative intensity of the exercise, and it might be lower cost compared to other device-based methods, although it depends. And limitations may not accurately capture sedentary time and can be affected by factors unrelated to physical activity, for example, stress, coffee intake, caffeine intake, medications, and so on. And the fourth possibility is pedometers. They are simple, cost-effective devices that count the number of steps taken by the wearer, but they are not very good, as they are just calculating the overall steps, but not actually how they are divided between the day. And often people are now preferring to use accelerometers rather than pedometers. Of course, if you have the pedometers, it gives some data that is useful, and it's device based. So I wouldn't be totally against using them, but I think they are a little bit old technology. And then fifth option is to use global positioning system, so GPS tracking. And it's quite good to get the location, speed, and distance, and especially for outdoor activities, but it doesn't really work that well for indoor. But if your idea is, for example, to get the outdoor activity and compare, for example, the nature-based physical activity to the urban areas, it would be a very good method to measure. And maybe adding what we don't have in the article, there's also now possibility to measure muscle activity in daily life with the swords, with the integrated electrodes. I did my PhD on the prototype of those, and now those are available. And the advantage of that is that you also get the relative muscle loading, how close you are of maximum of your muscle activation, and that's important because with that measure we can understand how much older people need to exert themselves from the neuromuscular point of view doing the daily tasks, and that might be the limiting factor. So I think measuring muscle activity in a way or another, if possible, is a good way of measuring the daily activity of older people. And if you're interested on the theme, there's a good episode with Dr. Tim. And if you're interested on the theme, there's a good episode with Dr. Tim Fleiner, and we are talking about physical activity, psychopathologies, and geriatric healthcare, and basically talking about device-based measurements in a clinical setting. And then if we look at the subjective measurement method, you can have self-report questionnaires, and there are many different. One of the most commonly used is IPAC, so International Physical Activity Questionnaire, and Sedentary Behavior Questionnaire, so a little bit newer one. And the advantage is low cost, easy to administer and analyze, and can access various types of activities. And the limitations are subject to recall bias and social desirability bias. And especially when we start to get very old participants who might have problems with memory, this really needs to be considered, the recall bias. How much will it influence the results? And it may not accurately capture all patterns of sedentary activities. And then another subjective measurement method is interviews and diaries, and they can be used to collect detailed information on daily activities and sedentary behavior through either structured interviews or self-recorded logs, and they can provide rich qualitative data on older adults' daily routines and activity patterns. And the advantages are that they can capture a wide range of activities and behaviors, and it provides detailed information on the context and specific activities. And I think the context is important when we try to understand and create interventions. And there are different tools to understand this, and you can check from our website the Fibion Insight, which is a platform that has Android and iOS app that you can collect different kind of questionnaire data. You can also use experience sampling method, which I will make another episode about it. But if you're interested on collecting data and for example combining with accelerometer data, please check our. And then if we go to limitations of interviews and diaries, they are time consuming for both participants and researchers. Although older people might have time for those, the question is whether the researchers have all the time to do them. And also they are, similarly to questionnaires, subject to recall bias and social desirability bias. And in our article, we have listed the different advantages and limitations in the table. So if you're interested, maybe check the article. And then if we think choosing the right measurement method for your study, so there are number of factors that should be considered to ensure that the chosen method aligns with the study's objectives and constraints. And probably one of the most important is the research question, like what do you want to find out? And that's important. And for example, if you're interested in sedentary behavior, you should probably go for device-based methods like accelerometers, probably worn on the thigh, that you can actually measure sedentary behavior accurately. If your goal is to explore perceptions of physical activity or context of physical activity, subjective methods are much more appropriate than device-based methods. And of course, important consideration is population and population's characteristics as age, health status, and cultural background. For example, a lot of older people start to have problems with memory, so then the subjective methods might not be the good choice. And you should also think whether they are community dwelling older adults or they are living in an elderly house or in a clinical setting, and this might have an effect on the tool that you choose. And of course, budget is a consideration. Some are cheaper than others, so the method needs to be fitting the budget of the project. And then one consideration is feasibility. You should assess the feasibility of implementing particular method within the study's context. I think with elderly people, it's maybe a little bit easier in that sense that they have probably more time than, for example, parents that have kids, small under school age children. So that might be a good thing. Of course, the tech savviness might be a difficult. So you should consider that what are the methods that are easy enough to use. And also we discussed about the possible skin problems with the older people and so on. So all of those need to be considered. And I cannot stress too much that do a pilot, test it in the real condition with the real participant and see how it works, and you will probably learn many things that you cannot think. And balancing accuracy and practicality. So the goal is to find balance between the accuracy of the chosen method and its practical implementation. And of course, what is the research goal? How accurate you need to be, and base the decision on that. And it's also important to consider combining methods for comprehensive assessment. Like said, subjective will give information about the perception, context, and so on, while the device-based is giving better information on the quantified aspects of the activity, like intensity, volume, timing, frequency, and so on. So it's a good idea to combine different methods. And we have actually an article about measuring the or combining methods and getting the context of physical activity and sedentary behavior. So if you're interested, head to Fibian.com and articles and you will find it there. So that's basically it for this episode. If you're interested for more deeper dive, please check the podcast episodes that I mentioned that are linking to the topic, and also check the articles that we have made. And would be great to hear feedback on episodes like this. But thanks for listening and have a great day.